Welcome to today's web chat about fertility preservation and in particular the decision around whether to have your eggs frozen. Thanks for joining us. My name is Ed Bottomley with the Michigan Medicine Department of Communication. Egg freezing, also known as cryopreservation, is a method used to preserve reproductive potential in women. Egg freezing is most often considered by women who are interested in safeguarding their ability to get pregnant or have a biological child in the future. Our goal today is to provide helpful information for individuals and couples who are interested in or trying to make a decision about having their eggs frozen. We know there's no shortage of advice from well-informed friends and family members, not to mention the internet. So we're also ready to do some myth busting today and to help you sort out the myths from the truth. So we'll introduce our panelists in a moment, but first just a few housekeeping items. You can submit questions at any time, even now, for our panelists to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or your profile name will be visible to others participating. Now, if you prefer a more anonymous option, you can send a private message to us via Facebook or email ask-mishmed@med.umich.edu, which is also up on the screen now too. If you can't stay for the whole chat or you want to share the recording with a friend, a video of the chat in its entirety will be up on the Facebook page later today and posted to the Michigan Medicine YouTube channel soon after that. So, on to our panelists. So I'd like to introduce Dr. John Randolph, a reproductive endocrinologist at Michigan Medicine. He was the director of the Division of Reproductive Endocrinology and Infertility here for more than 20 years and is the director of the Reproductive Endocrinology Fellowship Program at UM. He has done extensive research in ovarian aging and sees patients at our fertility clinics at Briarwood in Ann Arbor, as well as the Northville Health Center too. Sharon Dalt is a registered nurse at our Center for Reproductive Medicine in Ann Arbor. Sharon works with men and women being seen for a wide range of reproductive health issues. So I'm honored to have you both with me here today. Thanks again for joining us. Dr. Randolph, let's jump right in here to the topic at hand. Can you share with us a basic introduction to egg freezing? What is it and how does it work?
Egg freezing really has taken off in the past decade when we finally figured out how to freeze human eggs. That technology took a bit to be able to do. And basically, we're interested in doing that because women are born with a limited number of eggs that decrease over their lifespan, such that as they get older and as the number decreases, their fertility falls off, and the eggs that are remaining get older and don't work quite as well. So if we can freeze them in time, which was exactly what happens, then they'll have eggs that are the same age that they were when they were frozen and have them in storage. So even if they wait until after they no longer have viable eggs, they still may be able to get pregnant.
Thanks for the overview. That's a great overview. We're going to open up the questions now. One more reminder that you can submit your questions by commenting on the video directly, by direct messaging us on Facebook, or by emailing us at the email address on the screen right now. So we won't use your name when we read off your questions, but do know that if you comment directly on the video, your name or profile name will be visible to other participants. So let's move on to question 1. What are the benefits of egg freezing?
Sharon, want to answer that one?
Sure. So benefits of egg freezing, as Dr. Randolph already talked about, when we freeze your eggs, if you are 32, 33, 34, those eggs are the same quality as they would be in your 32nd, 33rd, or 34th year, and they're just in stasis. They're frozen until you're ready to use them. So maybe you're 40 when you are eventually ready to use them, and you still have 32-year-old eggs to use, and so they're higher quality and more likely to lead to pregnancy. This is also something that's going to take a lot of pressure or burden off. There's a lot of talk about women's biological clock, and it starts ticking in the 30s, especially around 35. People start getting worried about their fertility, and this would take that pressure off and that worry if you've got eggs frozen.
Anything to add, Dr. Randolph?
Yeah, and that's been the big driver for many women who are choosing to have children later in life, and it has permitted many women to be able to delay that into their 40s when they otherwise wouldn't have eggs that would permit them to be able to have a biological child. So it's opened up some possibilities for women to have the careers that they want and be able to have the family that they want.
Absolutely. We also do it in the setting of someone who's going to be undergoing maybe chemotherapy or radiation that could harm their fertility. And so there's a benefit there that despite having to go through pretty intensive medical treatment, when you come out the other side, you'll have eggs frozen that are just as good as they were before the treatment.
Thank you. The next question is a good follow-on from that. Is egg freezing safe?
As far as we know, yes. At least all the data would say that once eggs are frozen and they survive freezing, which more than 98% of them do, doesn't do anything to their quality. The children who are born from those frozen eggs seem to have the same capacity for development and growth and learning as any other children. So at least at the current time, the thinking is that it's actually quite safe.
Excellent. And what makes a good candidate for egg freezing?
Sharon?
That's a great question. So there are a few different things that we look at. The first factor is always going to be age. So depending on what age you are, that may or may not, the older we get, unfortunately, the less likely we're going to have a good outcome from oocyte cryopreservation. So that's one factor. And then we'll also look at your ovarian reserve. So we look at some blood tests and maybe an ultrasound to see what's the current status of your ovaries, and is it a good idea for you to freeze eggs? Are you likely to have a good outcome from that? The other thing that I would plug in here is financially. It is unfortunately not covered by insurance in most states. And so that's another thing to bring into that. Can you financially cover this without that being too much of a burden to you?
It gets a little tricky to try to decide biologically exactly how well somebody will do with egg freezing, because there's so much variation in how women's ovaries age and how her eggs may age. But in general, the older a woman is, the fewer healthy eggs she has left, and therefore as somebody gets older, there's less and less benefit to freezing eggs because the outcomes may not be as good as we would like them to be.
Okay, the next question that we have, what's the ideal age to freeze my eggs? Is it ever too early or too late?
That's a really tricky question, a great question, because it's a hard one to answer. It's kind of a balance of biologically, the earlier the better. Socially, it kind of depends, because for many young women, they anticipate that they will choose to have biological children and get pregnant the old-fashioned way. But for women who clearly want to delay their fertility, then freezing eggs earlier will provide the highest likelihood that they will be able to turn into a baby eventually. It gets trickier as women get older, because then we have that balance of trying to preserve what may still be there, but also is there a reasonable chance that the eggs that we get might work?
I think, once you reach about your mid-30s is a good time to start contemplating this, thinking about it, and maybe having a consultation if you haven't already thought about it. That being said, beyond mid-30s, that's not the cutoff, but just that's a good time to consider it.
Okay, now the next question is with regards to how do I start the egg freezing process? What tests do I have to have? And how do you determine ovarian reserve?
Yeah, so first step, call the office, make an appointment, meet with one of our wonderful physicians, and then we'll order some blood tests. There are a few different hormones that we look at for ovarian reserve. There's follicle stimulating hormone, also called FSH. There's estradiol that's always drawn along with follicle stimulating hormone. There's anti-Mullerian hormone. And then one other measure or way to look at ovarian reserve is by doing an ultrasound called an antral follicle count. And that just looks at the resting state of your ovaries and the potential there. Those tests need to be timed to menstrual cycles to get accurate results. So that is one thing to consider. But yeah, step one, just make a consultation and talk with a doctor, because we may say, let's think about it maybe in a couple more years, like you've got more time, or maybe we should move forward a little faster.
And those tests can be ordered by your local physician or provider. That makes it even faster if we have that information when you first come in, because we'll use that information together with your personal medical history and surgical history to give you the best possible sense of the utility and the potential outcome from egg freezing.
Okay, the next question that we have, how many eggs does a woman have?
It depends. Everybody starts out with a lot when she's tiny. Women peak about halfway through their mother's pregnancy with them. We believe it's somewhere in the range of 6 to 7 million eggs. And then after that, she doesn't get any more, but that number declines such that by puberty, when women acquire the capacity to get pregnant, it's down probably to a couple 100,000. And then at menopause, it's down to a few hundred. The other tricky part about that is that as eggs get older, the ones that are still remaining, they also start to diminish in quality, so that an increasing percentage of them don't work as well as they should. So it's a combination of numbers and a combination of quality that help us get some sense of what your capacity to get pregnant might be.
Okay, and the next question we have rolling in, will I run out of eggs sooner if I freeze my eggs now?
You will not. So when we do an egg freezing cycle, we are only taking eggs that would eventually have been lost that cycle anyway. When you start a menstrual cycle, there's a cohort of eggs that's available, and not all of them continue to grow. We only ovulate 1, maybe 2 eggs each cycle. So what we're doing with the egg freezing process is we're giving your body stimulation so that instead of just 1 or 2 eggs ovulating, we're getting that whole cohort to grow together. And those would be lost. You wouldn't have those with the next cycle. So we're not taking any additional eggs. There's no harm to your fertility potential with this process.
Okay, and the next question is quite a long one here. I'm concerned about the recent events at IVF clinics where storage failures occurred. How do I know that my eggs will be kept safe? Where is the safest place to store eggs long term?
I don't know that we know that there's any one particular place that's substantially better. For what we have done primarily is there are a number of commercial long-term storage facilities that are set up with extensive backup capacity and alarm systems to try as much as possible to prevent what happened at those 2 clinics. All clinics have systems like that, but the facilities that we will recommend for long-term storage have multiple layers of security to try to prevent that from ever happening. And as an aside, in my 30-odd years of practice, those are the first 2 reports I've ever heard of facility failures like that. So it's really a very, very uncommon problem that occurred.
I want to add just one thing to that. As you're thinking about storing your eggs, one other thing to consider is the cost of storage.
Right.
And those long-term storage facilities that you can have your eggs shipped to are generally less expensive than if you were to, say, keep them at our clinic. So that is another consideration about using those places.
And there's minimal risk in sending frozen eggs all over the world. We do it all the time. And so there are very well-established protocols for doing that to keep them safe.
Thank you. Next question. What do I have to do to prepare for having my eggs retrieved?
So, preparation process includes some pre-testing. So we already talked a little bit about the ovarian reserve testing that needs to be done, making sure that looks like you're a good candidate. We'll also do some infectious disease screening prior to having anything come through our lab. We always do that on everybody. Once that pre-testing is done, we always bring you in for an education session so that you know how to do the medications, because they do get pretty involved. And then we get those medications ordered and make a plan for you. So we time everything out. One thing to consider is making sure that you do have a chunk of time that you're going to be in the area. We can't do an egg freezing if you are constantly traveling, because it does require a lot of monitoring at the clinic. Beyond that, there's financial preparation probably as well to consider.
And
Yeah.
be healthy. Make sure that
yeah.
your medical circumstances are fine. It's not a risky process in general, but there are some things that we want to make sure you're going to be safe, particularly that it's safe for you to undergo the retrieval process, which is it's a pretty simple outpatient procedure, but it still is a procedure. And be good, prepared mentally too.
Yeah.
Dr. Randolph, I think you read my mind there, because the next question is, can you explain the process of egg retrieval?
Well, there's kind of two parts to the process. One is most places will stimulate your ovaries to try to grow as many of the eggs that you start that cycle with, so that we can get as many as possible. And in general, that usually involves injectable medications that you usually give yourself at home every day for anywhere from 8 to 12 days. During that time, there will be several office visits for ultrasounds and blood work to follow and see how you're responding. The actual egg retrieval procedure, as I mentioned, a simple office procedure. We do it with an anesthesiologist, an intravenous line, and some medication so that you're asleep and don't feel anything. And then we use the same ultrasound that we use to monitor the growth of your eggs through your vagina, and slip a little needle in the back of your vagina into the ovaries to take out as many eggs as we can. That takes about 15 to 20 minutes, and afterwards it's a fairly quick recovery, and then you go home and go about your normal business the next day.
And the next two questions I think we can pair in together. Can you explain the freezing process, and can you explain the thawing process?
Take that one?
I'll let you do that one.
Okay. It's fascinating because once we give the oocytes to the lab, and actually in our facility, you can wave through the door at the lab person who's going to be taking care of your eggs. Almost seems like you get to know them on a first name basis. They're going to take really good care of your kids. And then they will look at them and find the ones that are healthy and mature. And they're actually put relatively quickly into liquid nitrogen in some special fluid, so that they're very, very quickly what we call vitrified, which keeps them from developing ice crystals that might damage them, because they're pretty large cells. And then they're kept in liquid nitrogen for as long as you decide to have them there, which could be years, and they're basically in suspended animation. And then when the time comes for you to use them, we bring them out of the liquid nitrogen and actually put them into kind of a warming solution, so that they very, very quickly, it only takes a few minutes to do that. And then we look at them immediately to make sure that they still look as healthy as when they went in. And as I mentioned earlier, usually 98% or more of the eggs that are frozen will survive and look healthy.
Okay. Next question we have. I am single and have not shared my decision to freeze my eggs with friends and family. I won't have a lot of people to talk to during the process. Are there support groups or resources for women going through this?
Absolutely. We've got
wonderful support right here.
You can always talk with the nurses, but one thing I do love about our clinic is we have 2 wonderful social workers on staff who are available to talk with you, and they always reach out to all of our new patients that come into the office, and so you'll have that resource as well.
And if you need any other additional resources, the institution has fabulous resources for anything more than that, including more intensive psychiatric help if that should ever be necessary, although that's pretty rare.
Okay. Our next question, how many eggs should I aim to store to eventually achieve a pregnancy? I know some women end up doing multiple egg retrieval cycles in a row, which seems like it would be very expensive.
Absolutely. Each cycle is a chunk. I don't know that we have spectacular data in being able to tell you that, but a lot of it depends on how old you are. And we do have some statistics about expectations based on your age, which is the best predictor that we have to give you a sense. Kind of a really ballpark estimate is if you're between 38 and 40, probably about 1 out of 20 of the eggs that we get is going to be really good and be able to use. And so getting some level of that number may be necessary to make you feel comfortable that we'll have some eggs that are likely to work. But the number varies a lot depending on your age.
And on to our next question. I've heard that hormone injections can hurt. Is this true?
So they are injections, so it is a needle poke. So there's a little discomfort there, but for most women, it's a very, very small needle, and so it's not that uncomfortable, and most women do absolutely fine with the injections. It's very intimidating when you're first starting out and you know you have to go home and do injections on yourself. So we do an intensive education session, and then we also let you do a practice injection in the office to make sure that you're comfortable with it before going home and doing it without any support person there in terms of medical staff next to you while you're doing it. The injections that we use, they're all what we call subcutaneous injections. So a lot of people, when they think about an injection, they're thinking about, ooh, I went and I got my flu shot, and that was really miserable because that's a pretty long, big needle. And the flu shot, the vaccine itself can be very sore, which is not the case with these injections. It's a very short, thin needle, and the medication, you might have a little sting with it, but it's not a lasting discomfort.
A lot of people have friends or family that have diabetes, give themselves injections every day, and so these are very much in the same vein as insulin injections.
Okay. The next question, are there side effects to these injections or any other medications I have to take during the process?
In general, the immediate with the injections, not really. What we get concerned about and watch very, very carefully for is the right dose for your ovaries, being careful to have enough stimulation to get as many eggs as possible, but not overdo it. There is a condition called ovarian hyperstimulation syndrome. If we get too much of a response from your ovaries, where your ovaries can get quite large and develop big cysts in them. So we work very, very hard to try to prevent that from happening and have a number of strategies to minimize the possibility. Typically that happens after your egg retrieval, and so we watch to make sure that you do fine if you have any of the risk factors that would make that more likely.
And the next question ties in nicely with that. What are the risks of this entire process?
So Ovarian hyperstimulation is one risk. There's always risks with the egg retrieval process. You will get what we call deep sedation, and so some people don't feel very well after having that type of anesthesia. We are using a needle, and so there's risk that you could have bleeding from the procedure, but that's very, very small. Like Dr. Randolph was explaining, as we're doing the egg retrieval process, everything is done under ultrasound guidance. So the needle is visualized the entire time. We can see the ovaries, we can see the other organs or structures within the pelvis and avoid them so that we're not causing undue injury. But if you don't have reaction to the medications, and if everything goes smoothly with the egg retrieval process, this is really a safe thing to do.
But one of the other risks, this is frequently really hard to get a handle on, is there's the possibility that your ovaries won't respond quite as well as we expect them to, and so you may not get as many eggs as we're expecting, and there's always the possibility that we don't get any. That's pretty rare, but it certainly has happened. And so everybody needs to go into it knowing that there is that remote possibility that we won't get what we want.
Thank you. Next question, can I still work as I'm going through the egg freezing cycle?
You can. We touched on previously that there are frequent monitoring appointments where you have to come into the office for ultrasound and blood work. So a lot of people do have a little trouble kind of getting that worked around with work, especially if they're not telling anybody at work that they're going through this process. It's kind of hard to explain why you're out of the office every other morning. But throughout the process, it's not like you're incapacitated. The only day that you have to take fully off of work is the day that you have the egg retrieval, and that's because you're going to get anesthesia that day. So you'll be sleepy and you need to go home and rest and kind of sleep it off.
But the medications don't affect your mental capacity, so people, they're a little stressed because they're going through a big process, but they're fine. They function fine, and many women who undergo this don't tell anybody, and no one knows because there's nothing visible.
If this is elective for you and you can kind of choose when you want to do it, you can kind of plan that ahead of time with work, and so that helps.
Okay, the next question, also related to the egg freezing cycle. Can I have sex while I'm going through the egg freezing cycle?
Sure, as long as it's comfortable. The limiting factor tends to be that as your ovaries get stimulated, they get larger and they may become uncomfortable. And so obviously sex is for fun, so ideally you'd be able to have and enjoy it. But it doesn't hurt anything. And then afterwards, since they don't go down immediately afterwards, we would have you wait until it was comfortable, but there's no risk in having intercourse when you're going through the process.
One thing I will add to that, though, it is possible when we do the egg retrieval that we don't get every single egg. So it is still possible to have an egg released and ovulate like a normal menstrual cycle, and so it is important to use barrier methods of contraception.
Okay, and then the third question with regards to the egg freezing cycle, can I exercise while going through the egg freezing cycle?
Absolutely. Again, it depends on comfort and how you feel and how big your ovaries get, but there's no reason to stop. In fact, we would prefer that you continue with your normal activity because you tend to and it's a stress manager, you tend to feel better if you continue to do your normal activities.
Okay, and then how many eggs should I freeze is our next question.
I think we touched on that earlier. Depending on age, we might be comfortable with 8 to 10 eggs. For a woman who's a little bit younger, as you get into the later 30s, then we'll want to get more because the ratio of good eggs that we get does get lower with age. So really it's hard to say right here. That is a conversation that you should have with your physician.
Right.
Okay. And can you tell me a little bit about the different kinds of freezing technology?
The original freezing technology was it was extrapolated from embryo freezing, which is what was called slow freezing. But embryos are very, very different than eggs. They're much more resilient to being able to do that. And for years we tried to do slow freezing with eggs, and it didn't work well because the eggs would get damaged. Vitrification has pretty much replaced slow freezing around the world, both for embryos and for eggs, because it actually works and allows us to have the same kinds of success and the same kinds of healthy eggs as we have had with embryos for a long time. So in general, that's what almost all labs have switched to.
Okay, and our next question, what percentage of egg freezing leads to the birth of a baby?
Once again, that's dependent on age and ovarian reserve factors. So you look here, I've got some stats. All right, so in one study of women who were less than or at age 29 when they froze their eggs, of eggs that were thawed and fertilized successfully, there was about 100% pregnancy eventually from that egg freezing cycle. And that goes down with age to once you get above age 40, with this specific study, the stat does decrease, and we see about a 3.7% success rate.
So it's very, very age dependent.
Yeah.
But a lot of the information that we're getting is being added to all the time. We're getting better and better numbers to be able to try to help individual women get a sense of what their individual capacity may be.
You said at the beginning of the presentation that we've only really successfully been doing this in the last decade, and so that's a pretty short time frame in terms of getting long-term data,
Right.
because some of those eggs that have already been frozen may not have been used quite yet, and so it definitely is something that we want to look at over time, and we just need more time.
But a lot of the early information that we had was the first egg freezing was done, as Sharon mentioned earlier, in women who were at risk for losing their eggs because they were undergoing chemotherapy, and many of them haven't chosen to use their eggs yet, so we don't have outcomes just yet. But as women are doing more and more lifestyle oocyte freezing, we're gradually getting better and better data to be able to counsel you with.
Okay, and the next question, a little bit of a follow-on from that, what are typical fertilization rates and embryo conversion rates?
In general, with healthy sperm and healthy eggs, fertilization rates are in the 70 to 80% range, and with frozen eggs, it's essentially the same as with fresh eggs, so there's no significant difference with the freezing process. The embryo conversion rate really depends on the age of the woman at the time the eggs were frozen. So you may be 45, but if you froze your eggs at 35, then you will have the same kinds of rates that we would expect from a 35-year-old. So that your eggs get frozen at that point in time.
And the next question we have, what happens when I want to get pregnant?
Yeah. So at that point, if we've got some good eggs frozen, you would come back to the clinic and we would once again do some pre-testing. This time we're not looking at your ovaries because we've already got the eggs, but we're looking more at the uterus. We want to make sure that there's nothing inside of the uterus that could prevent an embryo from implanting appropriately. And we're going to look at how easy it is for us to get a catheter through your cervix, making sure that on the day of an actual embryo transfer, when we have a precious embryo on the line, there's no issues with us getting a catheter through your cervix. So we'll do that kind of pre-testing, a little bit of blood work, making sure that your thyroid's well controlled, etc. And then we'll make a plan for your cycle. The preparation for an embryo transfer is much different than for an egg retrieval. Since we're not using the ovaries at all, we use a medication that's going to suppress ovarian function while still thickening the uterine lining. That's medication is called estradiol. Estradiol is one of the very important hormones that's produced in our bodies naturally. And so we give you that medication. It works both to suppress ovarian function, thickens the lining. We do some blood work, making sure that everything looks good in that cycle. Once you've been on the estradiol for about 2 weeks, we'll do an ultrasound to make sure your lining's gotten thick enough, start you on some progesterone, some other medications, and about 5 days later, you have an embryo transfer. When you're thinking about fertilization, because we've got these eggs frozen, but they're not embryos yet, that can be done either ahead of time, and the embryo's then refrozen, or as you're going through that cycle, we can thaw the eggs and fertilize them and time everything appropriately so that they're put in the uterus at the appropriate time. When you've had eggs frozen, the way we fertilize them is a method called intracytoplasmic sperm injection, or ICSI. That's where one really good-looking sperm is selected and injected into the egg.
And typically, what most women choose to do is to thaw all of the eggs that they have, fertilize all of them, and then watch them grow. Not all will fertilize and not all will grow. So the ones that do look healthy, typically we would transfer the best looking, the prettiest one, about 5 days after it's been fertilized, and then we have the option of freezing the rest of them if they look healthy. Or some women will choose to have genetic testing done at that time and then refreeze their embryos until they get the results of genetic testing back.
Okay, our next question is with regards to cost. How much does this cost, and does insurance cover it?
That's a great question, an important question. So unfortunately, Michigan, some states do mandate coverage for both IVF and egg freezing, and right now Michigan is not one of those states. So I don't know of any insurance plans in Michigan that will cover egg freezing. That being said, if the egg freezing is being done for fertility preservation in the setting of chemotherapy or radiation for cancer treatment, there are programs that help with the costs and bring it down quite a bit, and you also get free medication. So if you're doing this for lifestyle or social reasons, then you could expect the facility costs to be $11,000 to $12,000, so that includes pre-testing, the monitoring throughout the cycle, and the egg retrieval itself. But you also have to take into consideration the medications for the cycle, which can cost several $1,000s as well. So all important things to consider. And then the last cost that you have to think about in terms of when you're freezing eggs is storage costs. So there is an annual storage cost as well. If you have it at our facility, that's about $880, and if you choose to ship it elsewhere, then that's facility dependent.
So the next question, we also, and this has been, I think you touched on this already, does insurance, we're going to move on to the next insurance question, does insurance cover having your eggs frozen differently if it's for medical reasons, such as if the person is going through a cancer treatment?
Yeah, so once again, insurance still isn't really going to help you out, but there are a couple of wonderful programs that do. The Livestrong program is one that brings down the total cost, the total facility cost of your IVF cycle or egg freezing cycle to about $5,500. So that's a huge decrease. And then you also get those very expensive stimulation medications for free through Livestrong and through Walgreens Heartbeat program. So there are programs if you find yourself facing a cancer diagnosis and you've been counseled that the treatment may harm your fertility. It's definitely worth having a visit with a reproductive endocrinologist and chat about freezing your eggs.
But we always recommend checking with your health insurance plan. Some companies are now offering oocyte freezing as part of their benefits package, and we hope that that's going to increase both for women who are at risk for losing their fertility and for women who would like to delay childbearing. So always check it out and find out when, because you might get surprised.
Yes. There's new legislation being passed all the time. So, some states already mandate that coverage for both IVF and egg freezing, even if it's social. Some states have mandated coverage if it's for fertility preservation in the setting of cancer or other health concern that the treatment could impact fertility. And so I feel like there's a trend. And so
right.
I feel like eventually every state will get on board with this really important legislation.
Yes.
So.
Okay, so our next question, how long can my eggs stay frozen?
No one knows. Although best guesstimate is for years and potentially decades. The original freezing was actually freezing of cow embryos back in the 1950s. And there are still frozen cow embryos from then at the University of Wisconsin that get thawed out every year, and they're just as good as when they were thawed or when they were frozen. So we believe that they're probably good for certainly as long as you would want to use them. So that's not something to worry about.
Okay. Next question we have up, can they do genetic screening for certain conditions before fertilizing the egg or only after?
We can screen you, but we can't screen individual eggs. We don't have that capacity just yet. But we always offer genetic screening for specific conditions to anybody who comes to see us. And there's a growing number of diseases that can be tested for. We don't look at all the genes just yet, but there are certain things like cystic fibrosis and spinal muscular atrophy that can be screened for. As I mentioned earlier, there is the capacity once your eggs have been fertilized and are embryos to test them either for the number of chromosomes that they have or potentially for specific genetic diseases if there is something like that in your background that you would like to avoid in your children.
And our next question, how much does it cost to store eggs for up to 10 years on average?
Well, depends on the facility that you have them stored at. Our current cost, as I said before, for annual storage is about $880, but that does change, and typically when it changes, it increases. But like I said earlier, there are long-term storage facilities that you can have your eggs shipped to where that cost would be much lower. So I can't really give an accurate number for a 10-year storage plan,
right.
But that gives you kind of an idea.
Yeah, and we usually recommend for someone who plans on storing her eggs for a number of years that's probably the safest and the most cost-effective modality is to use one of the big commercial storage facilities.
Okay. Can you speak to any type of home fertility kits and the results that may lead you to store eggs?
I don't know that there are any that are based on the same kind of technology that we would use to make an assessment of your future fertility. So I don't know that they give you the level of confidence because we are very honest in that we can estimate, but we can't reliably predict to any great detail for anybody. And so I would be a little bit wary of any claims of being able to give you a really good idea of what your fertility potential might be.
You can always listen to your body, though. If you're having changes in your menstrual cycles, that's something to be aware of, and talk to your physician about if they seem to be getting longer or shorter, the bleeding changes, that kind of thing. So,
but if you did find or use a commercially available modality to get some sense, bring those results in and come in and have a chat with us, and we'll certainly go through those with you and see, or supplement them with the more traditional medical modalities for trying to figure out where you're at.
Okay, and our next question, what happens if I freeze my eggs but don't end up using them? Do they get discarded after a certain amount of time?
It's your decision. It's whatever you decide to do because they belong to you. In general, most women who, say, get pregnant spontaneously and have children the old-fashioned way, they'll decide to discard them because they no longer choose to use them. So that's far and away the most common thing that women choose to do.
You can also choose to donate to research, or if you have completed your family and you have eggs frozen that you don't need, you could also consider them donating them to another person to use, because we do have many women coming in who are not able to get pregnant with their own eggs.
Okay, and our next question, I am 34 years old. I won't be in a financial position to afford egg freezing for another few years. Do you think it's okay to wait?
That's always a tricky question. It's actually a really common question for the exact same reasons. As I mentioned earlier, from a biological perspective, the sooner the better, because you have more good eggs now than you will have later on. And so, if that is a decision that you think that you would do, then looking into the strategy of how soon could you be able to do it, and when can you pull the resources together, kind of balancing out the finances and the biology as much as you can.
Okay, and our next question, is there a difference between freezing eggs versus freezing embryos? I'm 36 years old and in a relationship, but not sure if I want to start a family with my current partner.
So, I think we touched on this a little bit already, that our success rates in terms of having fresh eggs that are fertilized, our success rates for frozen eggs are the same as for our success rates for frozen eggs are the same as we would have for fresh eggs, as long as they survive the thaw. So at this point, you really don't need to freeze embryos.
And one of the big discussions we always have in women who ask this question is who has control of eggs versus embryos. If you freeze your eggs, they're yours, and you make the decisions about what to do with them. If you make embryos, then the source of the sperm will have a say if it's a known individual, and so you have to take that into consideration. So if this is someone that you may not be with in the future, you may not want to have that legal consideration and to have to worry about.
On to our next question. Can you talk about the emotional toll of this process? As a husband, how can I best support my wife?
Your bailiwick.
Be there every step of the way. Attend the appointments, attend the education, so that you have an idea of what's actually happening. It's a very complicated process as you're going through it. We'll walk you through, like we always walk anybody that's going through it. We are there every step of the way, but to have a support person at home, maybe you don't feel like sticking yourself with a needle, and to have somebody else who's there, who's able to do that, is a huge help. Just being there. A lot of women experience a wide range of emotion throughout the cycle as well. And so having patience with that and understanding and just being encouraging and supportive at home is huge.
And remember, to have a baby, it takes both of you. So this is not a one-person process. And so I think that's really helpful for couples to remember that your goal is to have a child together. And so being there for that is really important, and to recognize that biologically you're just as important.
Thank you. Our next question, how many cycles does it take on average for most women?
Age. Depends on age.
I don't, again, that's such an individualized question. It depends on your personal circumstances. So I think it'd be hard to give you a set number.
And our next question, my periods are irregular, can I still freeze my eggs?
Absolutely. As long as you have eggs there, you can almost always find some way to get them to grow and to get them. So that's not the issue in being able to make that happen. In fact, some women who have irregular cycles have lots of eggs. That we have to be careful we don't overshoot, and they may be at higher risk for ovarian hyperstimulation syndrome. So that's one of the things that we always assess ahead of time is how many do you have to work with.
And our next question, are birth defects any higher when conceiving through frozen eggs?
So there's about a 2 to 3% chance of having a birth defect when conceiving naturally. And with an IVF cycle, that's about a 2.8 to 3.5% chance. So it's essentially the same. And using frozen eggs, you have the same rates as with any other IVF cycle. So there's no increase in birth defects.
It's probably an all or none phenomena. The vast majority of eggs aren't affected by the process, and the very few that would be would not survive and wouldn't fertilize and become a baby.
Okay, here's our next question. I have the BRCA mutation and have undergone mastectomy. My gynecologist is recommending that I also have my ovaries removed to reduce the risk of ovarian cancer. Is it safe for me to freeze eggs before I have my ovaries removed, or will this increase my chance of developing ovarian cancer?
Well, as far as we know, the short answer is it's safe. In fact, that's one of the indications for doing egg freezing, somebody who's going to have her ovaries removed. Since you be having your ovaries removed, and that will remove the main reason for getting ovarian cancer, the short answer is it shouldn't increase that risk at all, because your ovaries won't be there. But even that stimulation that we do to get eggs doesn't seem to increase risk either of any kind of cancer, including women who have any kind of predisposing genetic issue, and breast cancer if they haven't had mastectomies already. So it seems to be a safe process.
Sharon, I know you touched on this a little bit earlier. Can you tell us more about options to donate frozen eggs if I end up not needing them? That's our last question.
Yeah, so our office doesn't currently have a way to donate those eggs anonymously, but there are agencies that can help you with that, or if you have somebody that you know, that's called directed or known donation, that's definitely an option. When you're talking about donating your tissue to somebody else, so we consider eggs to be your tissue, we do want to do some screening, and it is required by the FDA when your tissue is going to go into the body of somebody else. And so that includes infectious disease screening, a physical, and a questionnaire looking at possible exposure to infectious disease. So those are important things that you would have to do, but it's still an option.
Okay, so it looks like we're coming towards the end of our chat. That was our last question. But I always ask, is there anything that you feel that we've missed? Is there anything you think we should touch on? It was a good series of questions.
Yeah, I had wanted to make sure that we did touch on the fertility preservation in the setting of an illness that requires chemotherapy or radiation. And so we did talk about that a little bit, but I just always like to spread the word because when you get a diagnosis like that, it's already very overwhelming, and you may not, fertility is probably one of the last things on your mind. But a lot of oncologists these days are being more aware of that and bringing it up in their consultations. And we're very lucky at University of Michigan that we have a program that we can get people in at very short notice. And then we are able to work with Livestrong, with Heartbeat. And so the cycle's discounted, and we can get you through very, very quickly. And so it doesn't really delay treatment. So it is an option if you want to consider it.
I think it's important to keep in mind, as I mentioned earlier, this is still relatively new technology. It's evolving rapidly, and it's evolving socially rapidly, so that things are continually changing and will continue to change. Hopefully that will translate into improved access and decreased cost over the next few years. So hopefully every woman will have this option available to her in the not too distant future and can base those decisions on medical and social reasons and not on cost.
Absolutely.
Okay, well, Dr. Randolph, Sharon, thank you for your time and expertise. I really appreciate it. To make an appointment with Dr. Randolph or one of his colleagues, you can call our Centre for Reproductive Medicine at 734-763-4323. That's 734-763-4323. Information about their clinics and any of our other gynecologic and women's health programs and clinics is also available at umwomenshealth.org. That's umwomenshealth.org. Thank you to our audience for spending part of your afternoon with us too. We hope today's chat has been helpful, and we have a brief survey we've prepared to help us learn how we can make chats like this more helpful to you, and to help us identify more topics you'd like to hear about in the future. If you registered in advance, you'll receive an email with the link, or you can check the comments to this video on Facebook, and we'll have a link there for you to follow too. So once again, thank you for joining us. Have a wonderful afternoon.